All right, breathing poison. That's our campaign story on News9. And this cuts across regions. Whether you are a North Indian or a South Indian, this is a danger which is staring us in our face. And that's it, how toxic air harms mothers and unborn babies. So, ladies and gentlemen, it's not just about today, it's about the future, and it's about expectant mothers. Now, a day after a marginal improvement in Delhi NCR's air quality, the AQI has once again soared, with heavy smog reported across many parts of the city. Toxic smog continues to engulf the region as Delhi's overall AQI today stands at 353, firmly in the very poor category. Dense fog shrouded large parts of Delhi NCR today, slashing visibility and slowing traffic as the national capital continued to choke under severe air pollution. Many of my South Indian friends who travelled to Delhi at this time went back coughing and huffing and puffing. With pollution levels remaining alarming, the Delhi government has now moved into strict enforcement mode, rolling out its latest crackdown to clean up the air. The no PUC, no fuel rule announced by Chief Minister Rekha Gupta on 17th of December came into force today, denying fuel to vehicles without a valid pollution under control certificate. Across the city, petrol pump attendants are now demanding PUC certificates before refueling, while traffic police and officials from concerned departments are keeping a very close watch on its compliance. Additional staff, including DTC employees, have been deployed to ensure the rule is enforced on the ground.
In a stricter move towards curbing air pollution in the national capital, Delhi government has enforced stricter measures here. As you can see here in visual, this is the petrol pump and here people have gathered to get their PUC certificate checked and updated because from now onwards in Delhi for every vehicle, pollution control certificate is mandatory and without that you'll not be given fuel or diesel here in Delhi. So you can clearly see that people have gathered here and they are getting their pollution under control certificate checked and updated. This is the area where every procedure is getting done. We'll be understanding from him as well. Sir, यहाँ पर किस तरीके से प्रोसेस कराया जा रहा है?
ये पोल्यूशन चेक किया जा रहा है इसका।
ठीक है।
हाँ, और ये पेट्रोल नहीं मिल रहा, उस वजह से थोड़ा भीड़ ज़्यादा बढ़ गई है पोल्यूशन के लिए।
हम यहाँ पर देख पा रहे हैं कि एक ये वायर है, इसके थ्रू आप व्हीकल्स में इंस्टॉल करें और फिर पता कर रहे हैं।
हाँ जी, हाँ जी, इसका लेवल चेक होता है ना कि कितना पोल्यूशन है, मेजरमेंट कितना आ रहा है, ये चेक होता है।
अभी तक कितने व्हीकल्स को डिनाई किया गया है?
अभी तक 4-5 डीजल हो गए
और बाकी सारे यहाँ पर आके अपडेट करा के आपसे सर्टिफिकेट ले रहे हैं।
हाँ जी, हाँ जी, हाँ जी।
So as you heard that through this pollution under control certificate is getting prepared. First the pollution level is getting checked through this and after that certificates are issued. आप PUC सर्टिफिकेट बनवाने आए हैं?
मैं एक्चुअली मेरा PUC सर्टिफिकेट घर पर है लेकिन उन्होंने ऑनलाइन चेक किया है और उसमें वो बता रहे हैं कि वो एक्सपायर है। तो आपको बनवा लीजिए, फिर आपको पेट्रोल डाल देंगे। तो मैंने उनको ये बोला कि सर इतने सारे रोड पर गड्ढे हैं, हम लोग उसके लिए पे करते हैं, तो सबसे पहले वो लागू होना चाहिए, देन इसके लिए ना पब्लिक को पहले अवेयर करना चाहिए ताकि वो या लाइन में या भीड़ ना लगे, तो वो बेटर रहेगा।
At the same time, the government's ban on non-BS6 vehicles is set to disrupt daily life for lakhs of commuters. Older petrol and diesel vehicles will no longer be permitted on city roads, while the measures aim to cut emissions. Questions remain over execution, with Delhi's scrappage ecosystem still inadequate, with just one automated fitness testing center and a limited number of authorized scrappage yards, raising doubts over how quickly older vehicles can actually be phased out.
This is the Delhi-Ghazipur border where I am right now, and as you can see in the visual that a vehicle has been stopped here and inspection is going on. Now this is because from today several measures have been enforced in Delhi under which any vehicle which is below BS6 and that is registered from different state, then that is not allowed to enter into Delhi. Also, if I talk about the PUC certificate, then it has been made mandatory in the capital, and without PUC certificate no vehicles would be given petrol or diesel here. Sir, यहाँ पर आप अभी क्या चेक कर रहे हो?
PUC हाँ जी।
अच्छा, पीयूसी सर्टिफिकेट और किस किस व्हीकल्स को अलाउ किया गया है आने के लिए?
यहाँ पर B6 और सीएनजी और जितनी भी ये अदर स्टेट की गाड़ी है डीजल की, उनको वापस किया जा रहा है। सीएनजी ओनली। दिल्ली की पेट्रोल गाड़ी चलेंगी और डीजल गाड़ी नहीं चलेगी। BS4 दिल्ली नंबर भी, अदर स्टेट के नंबर पे नहीं चलेगी।
और सुबह से अभी तक कितनी गाड़ी को भेजा जा चुका है?
सुबह से अभी तक 4-5 गाड़ी को वापस करा जा चुका है और गाड़ियों को चेक करके।
So as you clearly see from this side that the car has been stopped and he is continuously collecting all the documents, and he will be showing that after the documents are verified, then after that he will be allowed to move forward. So as you heard, he is continuously checking all the pollution documents, and then once all the documents are verified, he will be allowed to move forward. And now this is happening at different border points in Delhi. Different border points, we have enforcement team along with traffic police, MCD, and they are continuously monitoring the situation. They are checking if any vehicle is below BS6 standard, then that is not allowed to enter into Delhi. And these are some of the stricter measures that have been implemented in the national capital so that the pollution level could be tackled and people could get some relief. With camera person Pratap Aparna Jha, News9 Delhi.
You know, considering this show is called the South Indian, let me take you through how's the South faring when it comes to pollution. That is today. This is today's data which was recorded relatively, an hour ago maybe, and better air. Chennai at 106, Coimbatore 45, Thiruvananthapuram 101, Bengaluru 95, Mysuru even better 56, Hyderabad 97, Amravati 156 and Vijayawada at 85. Now the thing is that we are today talking about a very important topic, and that being how does it impact the mothers, expectant mothers and their unborn babies. Now, it's not our intent at all to spread fear or create panic, ladies and gentlemen, but just deal with realities as it were. One of the most severe and I reckon unseen impact of severe air pollution that we as people of this nation are inhaling is the future of this country, being the serious impact on the unborn child and the mother who's expecting the baby. Let me refer to statistics here. According to the National Family Health Survey data, this is from 2019 to 21, 13% of babies in India were born prematurely and 17% had a low birth weight. And a major factor contributing to this was exposure to polluted air during pregnancy. The report highlighted how pregnant women exposed to high levels of PM 2.5 face a 70% increased risk of premature delivery, risk of low birth weight due to poor air quality, and a 100 GM rise in PM 2.5 levels is clearly linked to a 12% increase in preterm births. It's not that these babies are impacted and it's no fault of theirs either. What do? But what about their mothers? Because their mothers are supposed to take care, be happy at this time. But the thing is that they are now scared because there are apparently long-term effects on these children. Like there could be developmental delays and the risk of chronic diseases like diabetes and heart disease. Like I said, this situation is so tough for the baby and also for a pregnant woman, a life that she carries, the pressure that she has to really kind of bear. Experts say that constant exposure to air pollution can in some cases result in miscarriage and stillbirth. There is evidence of all that. But why am I telling you all this? Apparently in the trimester, it really impacts a pregnant woman. Again, no panic or no kind of, a paranoia. Just what is the way out? Should we stay indoors all the time, wear masks, or should health authorities devise a long-term plan? Dr. Rajesh Chawla, Senior Consultant, Respiratory and Critical Care, Apollo Hospitals, is joined us. Dr. Arun Gupta, who's Consultant Pediatrician, Fortis Hospital, and Dr. Anita Ramesh, a doctor from Chennai, Senior Consultant, Medical and Pediatric Oncology. A very warm welcome to all of you doctors, and for making the time. This is very tough time for all of us, but like I said, no panic, no paranoia. Look for the way ahead. I want to first ask you, Dr. Gupta, that what is the unseen impact on an unborn fetus, on an unborn child, as it were? What does this toxic air do? Whether I'm staying inside a room and I have, I can't all the time stay inside a room if I'm pregnant. I also need to go out and look at the trees and the flowers, even if I have a purifier. But tell me something, those women who are sitting on the road and working, even when they are 8 months pregnant, what does these pollutants do to the baby, doctor?
The unfortunate part is that in Delhi, the level of pollution remains high throughout the year, except maybe a couple of months of rainy season. Otherwise, whatever the level of pollution in Delhi is, what is called AQI, is almost 150 and 200 throughout the year. And particularly during this winter time, it increases to maybe 500, 600 times. Now, as a pediatrician, what worries us, all the expectant mothers when they are exposed to this particulate materials called 2.5 and 10, apart from them some toxic gases. Now, when mother inhales those toxic fumes and these pollutants through their lungs, they reach their bloodstream, and through bloodstream they reach to an organ called placenta. Now, this placenta is very vital to supply nutrients as well as oxygen to the babies. Now, when this pollutants cause some kind of inflammation and other damages to the placenta, the supply of nutrients and oxygen to blood babies compromised, leading to, in many cases, abortions, you can say stillbirth, the baby dies suddenly without any warning, premature deliveries, which poses itself a big challenge for pediatrician like us when we have premature baby. Low birth weight, the weight is lesser than expected for that gestational age. Now, these are the bigger issues which really worries us as a pediatrician, and they are the short-term issues, but long-term issues are also seen when
Back to you,
babies.
sir. I want to talk to you about the long-term impact, but let me first get opening comments from other doctors as well. Dr. Chawla, you're a senior consultant, respiratory and critical care. You know, just now we heard doctor talking about how it could be sudden death, you know. Dr. Chawla saying it could be sudden death, it could be, you know, a preterm child, it could be low birth weight, it could be several other things. Tell me something. Do you look at it? I've given birth to 2 children, and we were told not even go to places which are like smoky, like near a tandoor. I don't know if it was paranoia, but I was told that. But I'm asking you something. How serious is this, doctor?
It is very serious. You know, the reason is when we were young, the AQI was good. Still, we are having cough, and you know, we see even as a doctor also we get cough, sore throat more often in this season as compared to the other season in Delhi. And now these children, they are born, not only they are born with a very high IQ, AQI, but they are also born, the mother has been exposed to very high pollution level. All those effects which were enumerated by Dr. Arun Gupta, they occur. But when these children are born, you know, they are premature, they're more prone to infections, the lung development is not good, they keep on getting to the doctors more often. And you know, one of the very important thing which is being noticed is the effect on the nervous system. These children, when they grow up, they have what is called the CTH, the ADHD, that is attention deficit hyperactive disorder. Even neurodevelopment they have seen is less in these children. So we are going to have a lot of impact, but you know, it can't be weighed. You can't correlate that you took sweet and it was sweet you tasted. You can't really see the impact immediately. It occurs in many years, and our generations which are going to come are going to be weak, immunocompromised, and they will have a less lifespan, as it has been shown many times, less than 5 to 12 years.
Right.
Delhi is slowly becoming non-livable.
Right. Dr. Anita Ramesh, let me bring you in here. I don't want to create panic or paranoia. And, you know, whatever both the doctors said, Dr. Gupta and Dr. Chawla, the thing is that it's not that it will happen in all the cases. I mean, just throw some light on who is more prone, as it were, Dr. Ramesh. People, pregnant women who work on the streets, pregnant women who live in very congested homes, you know, where the windows are. I don't know, ma'am. I'm privileged, you know. So I'm not talking about the privileged class, you know, but I'm talking about the women of this country who are there, who are salt of the earth, as it were, Dr. Ramesh.
Yes. See, I'll just give you a little bit of another etiological epidemial is that's if you have a PM stands for particulate matter, and it can be 10 micrometers or it can be 2.5 micrometers. If it is 10, yes, all of us are inhaling, it goes into the lungs and sits into the alveoli. Yes, the mother gets affected. But if the PM 2.5, it is that they are very, very small particle, they are particulate with aerosol, and that enters from the alveoli into the blood system and circulates and crosses the placenta if you are carrying at that point of time. Now, this will happen where? It doesn't happen when you are in the rural areas because you're inhaling good green or fresh air. But yes, when you're in a city, crowded places, industrial area, even in tier 2, tier 3 cities where they are in a part of like Neyveli, lignite, or you are in part of aniline dye or rubber industry. So this gives rise to dust like ozone, O3, then it gives rise to sulfur dioxide, nitrogen dioxide, carbon monoxide, and the lead inhaled small particles. And these small particulate matter, along with the gas, they form aerosol and start circulating. So answering to your question, yes, women working in outdoors, in industrial areas, in highly populated areas, urban areas, in major industries like Neyveli or any other aniline dye, rubber industries, asbestos, all these are much more prone to be affected with the chronic lung disease for themselves, and subsequently if they are carrying, and which you call it as an environmental hazard or to the unborn child,
Right.
is at high risk compared to anybody in the rural areas
Yeah.
or working indoors or
Yeah.
house working mothers,
Yeah.
home mothers,
Yeah.
homemakers.
Okay. Dr. Arun Gupta, one has to look for solutions, and none of us are God here. But the government needs to have a very, very kind of a strong plan for this. Everywhere I read, and I'm not blaming anyone, they say wear mask all the time. I mean, I'm pregnant 8.5 months. I can't be wearing a mask all the time. Do not go out. I mean, unless I'm on bed rest. Why should I not go out? These are all my rights to go for a walk, right? They say that, stay in a room which has an air purifier. But Dr. Gupta, I think this we face in Delhi. And let me tell you, the South, although it's doing better than the North, there also the AQI levels are not as they were, let's say, 5 years ago. Things have deteriorated, sir. So it's not as if everything is there is, there are roses there and here we are living on, I live in NCR. But Dr. Arun Gupta, don't you think the government should have a robust plan? Sir, we have all faced COVID and there was a robust plan. If you're coughing, go to the doctor, take your oxygen level, see if you can isolate yourself, get yourself a bed. Why is there, this is our future generation, Dr. Gupta, these kids.
I think you're absolutely right. I think when pollution is there and is affecting each of us, and millions of people are dying directly and indirectly because of pollution. I think first of it should be a priority of the government. I think they we couple of months we discuss pollution during winter, then we forget it. Though it remains high 150, 200 throughout the year in Delhi. So one has to first of all accept there is a problem, there is a big problem, there's a health problem, there's an emergency. Now, once every structure of the government is focused there, then only they can make a plan. Otherwise it's just a political tossing here and there. Or Delhi itself, I think the major reason what happens in Delhi is all the roads are so bad. They're so dusty. Everywhere there's the garbage, dust is sitting there. So that dust is the primary cause of pollution in Delhi. I think the government has to really pitch in to cover those gaddhas, and those dust has to be covered. And I think, as you are right, I think how much we can remain dependent on the government is other way to look at it. Personal
Robust
protection
plan.
are to be like yes.
We need a robust plan. I mean, enough is enough. Like Dr. Saab said, every year we come, we discuss it. It's become drawing room conversation. AQI, did you see the AQI? Oh, I'm going for a party. I'm going to wear a mask. This is not a joke. And just by saying I'm sorry, it's not going to save all the expectant mothers or the kids or the elderly or those who are compromised because they have comorbidities. Dr. Chawla, I want to bring you here. Dr. Chawla, considering you are a senior consultant respiratory and critical care, are you seeing a lot of cases where little children are presenting themselves with, your regular occurrence of breathing issues. In my office, there is one, my colleague has a child. The child is on nebulizer, perfectly healthy child. Are you seeing a lot of cases now, Dr. Saab?
See, the number not only has increased in adults, even in children, as you are saying, it has increased. And when they get viral infection, normally it used to get better in 2-3 days time. Now it takes very long. The nebulizer is a bronchodilator. You give sometimes steroid inhalation depending on what the physician feels, and they are given to so the child can breathe. Now they are part of these viral infections which are very common in winters. But because of air pollution also, a lot of children you will find all the time there is a watery nose.
Tell me something.
and they're coughing.
It's not that 5-year-olds should not have it. They should also not have it. They are babies. But imagine a 6-month-old baby. How do you deal with it, sir? I want to ask you. I mean, the baby, if I say I'm bringing my baby to you, Dr. Saab, I have not stepped out. He's now 3 months old, but he cannot breathe. And can we, even if we want to correlate to this, we needn't, but if we correlate to this, how does one deal with this, sir?
It's difficult to correlate, but when you say the incidence of these sort of events increases in this season, that directly correlates that it is because of air pollution, which has increased in these 2-3 months, is the level of air pollution goes very high. So definitely the pediatricians, they have more admissions in the ICU during these seasons, and they have to give, normally they never used to give these bronchodilator that often. Now they have to give quite often. It is difficult to differentiate. So child is coughing and there is a wheezy sound, he'll give nebulizer to ease out the breathing. But I can foresee the number of patients. We were young, and now a lot of adults are facing. When these children are exposed for a few years, and when they grow, they will have much more symptoms.
All right.
And the incidence of respiratory illness in Delhi will rise definitely.
Yeah. Dr. Ramesh, we are talking about expectant mothers and we are talking about unborn children. But what about, apparently this also has an impact on those who are wanting to have babies, on the eggs of women, on the sperm count of a man. I want to ask you, Dr. Ramesh, isn't it high time that the governments, of respective, whether it's a center or state governments, because the Gangetic plain particularly is severely compromised, Uttar Pradesh, Bihar, I want to ask you that isn't it time now to leave it to the doctors to say, "Arey, we have so many hospitals, we have 90,000 beds." Doesn't suffice. I think we need a robust plan.
Yes, it's a health. As I told you earlier, it's a occupational health hazard, and it has to be taken with priority. And the government has to step in to make some preventive rules, regulations. Like one example is that in oncology and radiation, a pregnant mother is not allowed to enter into the radiation unit. Once you conceive, you have to tell. And neither you go for the chemo mixing ward. Like that, women working in working areas, they have to be given holidays and leave once they are pregnant. Next, the government has to take care of these pollution vehicles, which I saw in your visuals right away, the pollution content of each and every vehicle, the diesel vehicles, also the industrial waste industries, they have to, and construction areas, because they throw a lot of aerosol waste. And already we have several times discussed about the crackers during Diwali, but then other environmental polluting, anything which causes pollution has to be definitely curbed, and the limits has to be maintained, and not only during this time, but throughout the year. And health policies has to be in place. Like I told you, women can be exempted from working during those
very, very
pregnant
important.
months.
Yes. Dr. Arun Gupta, I have 1 minute left. Give us some hope, Dr. Arun Gupta. Considering we are talking about future generations, unborn babies, newborn babies, and also these mothers who want to have a child, they have a right to have a child. Is there any way out? When you said everything, I heard you. But when you said that, do you think it also impacts their thinking, analytical powers, doctor? Because They say oxygen, you know, if it doesn't go to your brain, I mean, I'm not a doctor, but I've brought up 2 children. So I want to ask you, are we looking towards a generation which may not be as good as all of us should be? It's his right, her right to do it, doctor.
Yes, you're so right. And what worries me more is about the long-term impact of these toxins and these pollutants on the babies. Once you are exposed to them, especially during the first 6 months of pregnancy, what we call first and second trimester. Now, these babies, when they are born, they have multiple reasons to have those issues in later on. The first, prematurity itself can cause a lot of issues in babies. Their neurological development may be compromised because of prematurity itself. And secondly, when the toxins are passed through placenta and goes to various organs of the body, it practically affects every part of the body. So in long term, you can have chronic asthma and allergies and neurodevelopment issues. And Dr. Chawla said ADHD and autism. These are the things which can affect whole generation to come. So I, again, my wish is, my plea to the government with folded hand is that please take it as an emergency measure, stop everything else. Now think it of what is an initial emergency, and it can be tackled. I am sure it can be tackled. So we may not be able to bring it to like 20 level, but 100 can be brought in Delhi itself. If you have a robust system and you have political will and you're really inclined to do that, I think you can do it.
On that note, thank you very much, Dr. Chawla. Thank you very much, Dr. Gupta. Thank you very much, Dr. Ramesh, for joining us on this broadcast. Very, very important discussion. It's not about now and today. It's about the future, and it's about the right of our kids to have a safe life and good health. But is it going to be possible? Maybe the government should now wake up after a long, long slumber.